objectives at the end of this lesson. Students should be able to mark the attachment of the muscles and ligament on fibula, elaborate the joints formed by it, describe the nerve injuries related to it. Extensor digitorum longus. As the name indicates, extensor means it will extend. Digitorum, it will extend digits. Longus, the muscle is long. So extensor digitorum longus, as you can see, this highlighted in green, is extensor digitorum longus. It divides into 4 slits which are attached to the lateral 4 digits of the foot. So this is long muscle. When it will contract, it will get shortened, it will extend the digits upward, right? Now it arises from medial surface of shaft. So if you remember, we have a medial surface, a lateral surface, and posterior surface of on the shaft of fibula. So it arises from whole of upper 1/4 of the medial surface. Now you can see this is the medial surface. This is the medial surface, which is very narrow from in its upper 2/3, but slowly it comes down, it gets little broader. So this is the medial surface. From this side will be posterior, from this side will be lateral, and this is the anterior border, right? And this is the medial border, this one light. So it arises from whole upper 1/4. As you can see, this is whole upper 1/4 of the medial surface. So this orange is not the medial surface. Like this elevation is the medial crest, not medial surface. Medial surface is just this dark red in color, right? The medial to the dark red color, this orange color. So this orange color is not medial surface, remember, right? So medial surface is just this much. Let me show you with the pointer. Yeah, medial surface is starting from here. Now you can, this is the medial surface, right? This one. This orange, this region, this is the medial crest. So all of this upper 1/4 gives origin to the extensor digitorum longus. As you can see in this diagram, this is the extensor digitorum longus. So it is originating from the medial surface of upper 1/4, whole of the upper 1/4 of the medial surface. Now anterior half of the middle 2/4. Now you can see this is the anterior border and this is the medial crest, right? And this surface is the medial surface. So this half will be this yellow one. This half will be the posterior half and this half will be the anterior half. Because this is medial surface, as we are seeing this is like looking like an anterior surface, but if we will turn it anti-clockwise towards the medial side, suppose this is right fibula, right? So we'll turn this towards the finger side, right? So then this surface will go little tilted towards the this side. So this part will be the posterior and this part will be the anterior. So middle to 4th of the anterior half of the middle 2/4. Now this surface is divided in its middle part, anterior half, and this yellow is the posterior half of middle 2/4. This is 1/4, this is and the other 4th. These are 2/4. So 2/4 are bifurcated into 2 because they give two different attachment to the different muscles. So this red area, or this highlighted in red, is the origin of the extensor digitorum longus from whole of upper 1/4 plus anterior or half of the middle 2/4. I hope you are understanding that. Like suppose this is the total surface of medial surface, right? This is 1/4, this is 2/4, this is 3/4, and this is the 4th. Now this muscle takes origin from this, like this region, and then anterior only half of the middle 2/4. These are the middle 2/4, and this is the anterior half. So this is the origin of the extensor digitorum longus. I hope we are clear now. Now we have extensor hallucis longus. Hallucis means toe, great toe. Extensor means it will extend. Longus means this muscle is long. Arises from medial surface of shaft. As you can see, this is arising from the medial surface, and it is getting insertion, or it inserts on the great toe. So this is the extensor hallucis longus. Arises from medial surface from posterior half of its middle 2/4. This is the posterior yellow one. Posterior half of its middle 2/4. So this is the extensor hallucis longus, and this is the extensor digitorum longus. The anterior half was occupied by the extensor digitorum longus. The posterior half is yellow one, is giving origin to the extensor hallucis longus. Now as you can see, this triangle, this is the anterior border, this is the medial border, and this is the posterior border, right? Now if this is the medial surface, this is lateral surface, and this is posterior surface. If I talk about this portion, right, so to make it easier for you to understand, so this will be the anterior half, right? This is the anterior half, this is the posterior half, because this is the medial side, and this is the lateral. Lateral will have, this is medial anterior, and this is posterior. So similarly, this is anterior and this is posterior half. So this anterior half is giving origin to the extensor digitorum longus. This posterior half, that is yellow over here, this give origin to the extensor hallucis longus. This highlighted in green is the extensor hallucis longus. Now peroneus tertius, the word peroneus or fibularis is the same thing. So if the fibularis longus, fibularis tertius, fibularis brevis, or fibular nerve or peroneal nerve. So word peroneal and fibular are same thing. So don't get confused if sometimes I say fibular, or sometimes I say peroneus, or you see or read somewhere else. So don't get confused in that. Now peroneus tertius arises from the medial surface of the shaft. Again, medial surface of the shaft. So this is the third muscle which is arising from the medial surface of the fibula from lower 1/4. Now this lower 1/4 is giving origin to the medial but to the peroneus what tertius muscle, right? Now again I draw, suppose this is the medial surface, right? This is 1/4, this is 2/4, this is 3, and this is 4th. Now this 4th one is giving origin to the peroneus tertius muscle, this 4th, right? This is peroneus tertius muscle, and this is giving origin to the extensor digitorum longus, upper 1/4 plus whole of upper 1/4 plus anterior half of middle 2/4, right? So this red is origin of the extensor digitorum longus, and this posterior 2/4 of middle 2/4 posterior half, this gives origin to the extensor hallucis longus, this one. So there are three muscles which are taking origin from the medial surface of the shaft are: number one, extensor digitorum longus, extensor hallucis longus, Peroneus tertius muscle. So again revise in your mind: extensor digitorum longus, extensor hallucis longus, and Peroneus tertius muscle. This is Peroneus tertius muscle. You can see this is arising from the medial lower fourth. Now in this you can see these are the this is the extensor. This one is the extensor Hallucis longus, and these four slips are of the extensor digitorum longus, and this muscle is Peroneus tertius, this one. Now we have a quiz. Before we move forward, I have a quiz. Uh, Identify structures marked with arrows, right? This quiz is for the previous half of the class, for the osteology of the what? Osteology of fibula. Highlighted with green arrow. What is this structure? Highlighted with yellow, highlighted with blue, highlighted with purple arrow, highlighted with black arrow, highlighted with red arrow. So you have to identify the structures marked with the different colors of arrows in different colors. Quiz again, you have to identify surfaces. Which surface is this one? This is like slightly twisted on its lower half backward. It is twisted backward in its lower half. And this surface, you can see, this is grooved part, this is flattened part, and there is a central crest in the middle, and it's a upper 2/4. So you have to identify these both surfaces. Now Peroneus longus, again Fibularis longus or Peroneus longus are the same things. Peroneus longus arises from the lateral surface of the shaft, uh, or you can say the lateral surface of the shaft give origin to the Peroneus longus muscle from upper 1/3 and posterior half of the middle 1/3. If we can see upper 1/3, this is upper 1/3, this is middle 1/3, and this is lower 1/3, right? So upper 1/3, this highlighted in a red color, this is the lateral surface which is slightly twisted backward in its lower part, and this is the upper 1/3 and posterior half of middle 1/3. Now this will be the posterior half of the middle 1/3. As I already told you, this is the anterior border, this is the medial border, and this is the posterior border, right? Now this is the medial surface, this is lateral surface, and this is the posterior surface. Now this half of the medial surface is the anterior half, and this half of the anterior surface is the posterior half. Similarly, this half of the anterior surface, which is yellow, highlighted in yellow because this is the anterior border and this is the posterior border. In between anterior and posterior border, the surface is the lateral surface. So this is the anterior half and this is the posterior half. So this is Peroneus longus taking origin from the upper 1/3 plus anterior half of the middle 1/3. This highlighted in red is the origin of the Peroneus longus muscle. As you can see in this diagram, this highlighted in green is the Peroneus longus muscle. The Peroneus longus muscle is the muscle of the lateral compartment of leg. So I hope we are clear. Now we have Peroneus brevis muscle. The Peroneus brevis muscle will take origin from the anterior half of its middle one third and whole of the lower one third. Now this is the whole of the lower one third plus this is the anterior half of the middle one third. So this is the Peroneus brevis muscle, and posterior half of the middle one third plus whole of the upper one third is origin of the Peroneus longus muscle. So this is Peroneus longus and this is Peroneus brevis muscle. Let me draw it. Now suppose this is Peroneus longus and this is Peroneus brevis. Right? So this whole is the like a lateral surface from 1/4 whole of the 1/4 plus posterior half of the middle one third, and this is the anterior half of the middle one third plus whole of the lower one third. So this is the Peroneus brevis and this is the Peroneus longus muscle. Common peroneal nerve terminate in relation to the neck of fibula. As you can see, this is the common peroneal nerve, which is part of the sciatic nerve. Sciatic nerve is composed of two parts, the tibial part and common peroneal part, which bifurcate in the posterior behind the knee, or you can say the popliteal fossa, into common peroneal part and tibial part. So it divide into the two terminal parts. The the tibial part supplies the posterior compartment, where the common peroneal part which wind around the neck of the fibula and it enters into the lateral compartment. So this region of the common peroneal nerve, which is in close relation with the neck of fibula. This is clinically important point because of the injury of the neck of the fibula is very common, and in this relation the clinical anatomy is important, that is foot drop, we will discuss in a while. So this common peroneal nerve, it is in close relation with the neck of the fibula, and then it bifurcates into two terminal branches. These are the superficial peroneal or deep peroneal and superficial peroneal. The deep peroneal which enters into the anterior compartment, which supplies the anterior compartment, where the superficial peroneal stay in the lateral compartment and supplies the lateral compartment. So this is the common peroneal nerve, which is part of the sciatic nerve. The other part of the sciatic nerve is the tibial part, which enters into the posterior compartment, supply the posterior compartment, whereas the common peroneal or common fibular part, which wind around the neck of the fibula and bifurcate into two terminal branches, the deep fibular or deep peroneal and superficial peroneal. Superficial peroneal stay within the lateral compartment and supply there, whereas the deep peroneal enters into the anterior compartment and supply the anterior compartment of the leg. Soleus muscle. Soleus muscle arises from the part of the posterior surface between medial crest and posterior border, right? So medial crest and posterior border, as if you remember, this is the posterior border. How did I say this is posterior border? Because it's lined with the styloid process superiorly, and inferiorly it is this is the medial border of the posterior surface of the lateral malleolus, which is grooved by which is grooved. So this is the posterior border. And why did I say this is posterior? Because upper half of this surface is bifurcated by this medial crest. Now this line in the anterior part of the neck, and this border is the interosseous border. So this is the interosseous border, which ends at the roughened triangular surface above the triangular articulating facet for the talus at the lateral malleolus. So it bifurcates at this roughened area. So this is the interosseous border. Surface in between posterior and interosseous border is the posterior surface, which is largest among all, and in its upper half it bifurcated into two parts by the medial crest. The posterior is the flattened one, and the anterior half is the grooved one. You can see this is more clear in this. This is the grooved part and this is the flattened part. So posterior is the flattened part and anterior is the grooved part, or you can say the part lie in between medial crest and interosseous border is the grooved part. The part which lie in between the medial crest and posterior border is the flattened part. Now soleus muscle take origin from the upper 1/4. This is the upper 1/4. This is the upper 1/4 of the part of the posterior surface between medial crest and posterior border. So that is the flattened one. This is the flattened one and this is the grooved one. So the flattened part, which is in between the medial crest and posterior border, so upper 1/4 of that part give origin to the soleus muscle. Now flexor hallucis longus muscle. Flexor means it will flex, hallucis means it will flex thumb, longus means this muscle is long. The part of the posterior surface between medial crest and posterior border, again same but lower 3/4. Now I will show you which is the lower 3/4. Now this was the upper 1/4 which was giving origin to the soleus muscle. Now lower 3/4, this rest of the uh, posterior surface which lies in between the medial crest and posterior border, this gives origin to the flexor hallucis longus. As you can see, this is the highlighted in green is flexor hallucis longus. Now it is coming behind the leg and it passes under the foot and attached to the great toe. So flexion of contraction of this muscle definitely flex the toe, great toe. Tibialis posterior muscle. Tibialis posterior muscle take origin from the part of the posterior surface between medial crest and interosseous border, the grooved part. Now this is the medial crest and this is the interosseous border, and between medial crest and interosseous border, this highlighted in orange is the grooved part of the posterior surface which gives origin to the tibialis posterior muscle, whereas the posterior flattened part which lie in between the medial crest and posterior border which gives origin in its upper 1/3 to the soleus, and rest of the lower 3/4 give origin to the flexor hallucis longus muscle. Biceps femoris muscle. Biceps femoris muscle inserts on the head of the fibula. Yeah, you can say the head of the fibula receives insertion on anterior lateral slope of the apex. Now before I give you like quiz, which surface is this, which is this structure and which is this structure. So this is the circular articular surface on the superior part. This was the apex or the styloid process. Styloid process lies posterior laterally, where this slope, which is the anterior laterally, this slope is the giving origin taking insertion of the biceps femoris muscle. Now anterior, posterior and interosseous tibio-fibular ligament. Which ligament? The ligament which joins the tibia with fibula. So tibio-fibular ligament, that is anterior, posterior and interosseous in the middle. and the related to the interosseous membrane or interosseous border of both bones, right? So this is the medial surface, right? This is the what a malleolar fossa. This is the triangular articulating facet for the talus, right? And above that there is a triangular roughened area. So above this triangular articulating facet there is a triangular rough area which give attachment to the anterior tibiofibular ligament, posterior tibiofibular ligament, and interosseous tibiofibular ligament. Now you can see this is the posterior tibiofibular ligament, this one, and this which is not like joint, these are cut. So these are the this arrow doesn't show to this was already there. So this is the anterior tibiofibular ligament, and in the middle, which will be at the interosseous border of both, that is the interosseous tibiofibular ligament. Here you can see this blue is the posterior tibiofibular ligament. Now capsular ligament of the superior tibiofibular joint is attached around the articular facet. Now this is the articular facet. This is circular articular facet. Margin of the circular articular facet gives origin to the capsular ligament of the superior tibiofibular joint. Now capsule of the capsular ligament of the superior tibiofibular joint. Now you can see this 1 and 2 shows you the capsular ligament of the superior tibiofibular joint, which is attached around this circular articulating facet on the superior surface of the head of the fibula. Anterior talofibular ligament, as you can see, this is the talus and this is the fibula, and this is the anterior part of the fibula. So this is the anterior talofibular ligament. This is the calcaneofibular ligament. This is the calcaneum or heel bone, and this is fibula. So calcaneofibular ligament. Now you can see this is the anterior talofibular ligament, this one. Anterior talofibular ligament is attached onto the anterior surface of the lateral malleolus, or you can say the lower or proximal end of the fibula. So this was the anterior surface, this was the lateral surface, and this side is the medial, and here was the posterior, this grooved part, if you remember. So this anterior rounded and roughened surface give attachment to the anterior talofibular ligament, whereas the inferior part, this highlighted in green little bit, I'll show you in another picture, this one. Yes, this is the anterior talofibular ligament, this one, and this one, and this is the calcaneofibular ligament inferiorly. This is the inferior part, and this is the calcaneofibular ligament. This is the anterior tibiofibular ligament, posterior tibiofibular ligament, interosseous tibiofibular ligament, and anterior talofibular ligament, and calcaneofibular ligament. So these are the important ligaments which are attached at the lower end of the fibula. Posterior border gives attachment to the posterior intermuscular septum. As you can see, this is fibula, this is tibia, this is the anterior border, right? This is posterior border, and this is medial border or interosseous border. So posterior border gives attachment to the posterior intermuscular septum. This is the posterior intermuscular septum. So posterior intermuscular septum attached to the posterior border of the fibula, and this intermuscular septum divides the lateral compartment from the posterior compartment. This hole is the posterior compartment, which is largest among all. This is the anterior compartment, and this is the lateral compartment. So lateral compartment is separated from the posterior compartment. Posterior are too deep and superficial, so you will discuss in when you will do the compartments. So this lateral compartment is separated from the posterior compartment via the posterior intermuscular septum. This is posterior intermuscular septum, which takes get attached on the posterior border of the fibula. Now interosseous border give attachment to the interosseous membrane. Now this is the interosseous border which give attachment to the interosseous membrane, which again separate the anterior border from the deep posterior compartment. Anterior compartment from the posterior compartment, or you can say the deep part of the posterior compartment. Now the anterior border gives attachment, which is not written over here. This is the anterior border which gives origin to the anterior intermuscular septum. So this is the anterior intermuscular septum which separates the anterior compartment from the lateral compartment. Again I repeat, the fibula has three borders: medial or interosseous border, anterior border and posterior border. The medial or interosseous border give attachment to the interosseous membrane that separates the anterior compartment from the posterior compartment. The anterior border of the fibula give attachment to the anterior intermuscular septum, which separates the anterior compartment from the lateral compartment, whereas the posterior border of the fibula give attachment to the posterior intermuscular septum, which separates the lateral compartment from the posterior superficial compartment, or you can say the lateral compartment from the posterior compartment. I hope we are clear. This was not that difficult, I guess. The groove part, the groove on the posterior surface of the malleolus lodges the tendon of Peroneus brevis and Peroneus longus muscle. Now if you remember, this is the lower end of the fibula, or you can say the lateral malleolus, and this is the lateral surface of the lateral malleolus, and here is the anterior surface, and this was the posterior surface. So posterior surface was marked by a groove for the Peroneus brevis and Peroneus longus muscle. So this groove lodges the tendon of the Peroneus longus muscle. This is the Peroneus longus, and this is the Peroneus brevis muscle, this one. So this is the short muscle. This originates from its upper part and it goes all the way behind the lateral malleolus, and it goes under the foot, and it get insertion or inserts onto the base of the first metatarsal, where the Peroneus brevis gets from its lower half of the lateral surface, and then it goes behind, situated within the groove of the posterior surface of the lateral malleolus, and it get insertion onto the fifth metatarsal. So this muscle is short, that is why it is named as a brevis. This muscle is a long, so that is why this muscle is given name longus. Peroneus means fibula. So the groove on the posterior surface of the malleolus lodges the tendon of Peroneus brevis muscle and Peroneus longus muscle. Joints. There are three joints: the superior tibiofibular joint, inferior tibiofibular joint, and joint which is formed between the fibula and talus that participate in the ankle joint. So fibula has three joints. One, this participate with the ankle joint, within the ankle joint by the getting attachment with the talus bone, and there is the inferior talofibular joint and superior anterior tibiofibular joint, sorry, inferior tibiofibular joint and superior tibiofibular joint. Superior tibiofibular joint, inferior tibiofibular joint, and talofibular joint. Clinical anatomy. If the common fibular or common peroneal nerve is damaged at fibular neck before it divides into two terminal branches, which are the superficial fibular and deep fibular, there will be a resultant weakness or paralysis of anterior and lateral compartment of leg, because this fibular nerve will bifurcate into its terminal branches. These are the deep and superficial fibular, which supplies the anterior and lateral compartment. So anterior and lateral compartment nerve supply will be damaged before it divides, so the both and compartment weakness of the both compartments will occur, and that will cause foot drop with some inversion, right? So slightly foot will be inverted and foot will be dropped. So what is a foot drop? Foot drops means inability of the lower part or toe side or like a digit side of the foot to raise, to lift the foot from its toe side, or you can say from its digit side. This is the slap cat, or you can say this is the foot drop. Slap gait occurs due to the weakness of the foot, and slap gait is a heel gait abnormality that can be diagnosed by the hearing of the patient, walk or history from the patient. He will be complaining, I feel weakness on the anterior and lateral side of my leg, and when I walk I cannot lift my foot completely. The lower part of my foot, your toe side or finger side or digit side of my foot stays at the like ground, or it like swing within the ground, so it not clear the ground. So this is what is the slap gait or foot drop, which occurs due to the injury to the head of the fibula. Most commonly it can occur due to some other reason, but most commonly neck of the fibula get injured, and then injury to the common peroneal nerve can occur and result into the foot drop. BCQs. We have the peroneus tortius muscle takes origin from which part of the medial surface of shaft? Now you should be clear about it. The anterior half of the middle 2/4, whole of upper 1/4, posterior half of its middle 2/4, lower 1/4. Now I hope you will be like not getting confused because we have repeated. BCQ again. Regarding side determination of fibula, which one of the following statement is correct? This is the for the previous half. The upper end is expanded anterior posteriorly. The lower end is expanded in all directions. C. The malleolar fossa on the lower end lie posteriorly. D. The malleolar fossa on the lower end lies anteriorly. So which is the correct one? Summary. This is a lateral surface, this is a medial surface, and this is posterior surface. Now let me explain how did I say this is lateral surface. Number one, it is twisted in its lower part backward. This is twisted backward in its lower part. Plus I can identify this border. This is the anterior border because it bifurcates in its lower part and enclose a triangular elongated area which covers the lateral surface. So this is the lateral surface, and this is the lower bifurcation of the anterior border. Plus this is the posterior surface of the lateral malleolus. You can see this is the grooved part which lodges the Peroneus longus and Peroneus tortius, and plus this border is the posterior border and this border is the anterior border. How did I say this border is the posterior border? Because it lines with the styloid process. This is the styloid process. It lies in the line of styloid process, and then it comes downward, and then it ends at the medial margin of this groove on the posterior surface. This is the lateral margin of this groove, this is the medial margin. So this is for sure is the posterior border, and this is anterior border. Number 1 point, it is bifurcating at its lower part, plus this is lateral surface, and it's ending at the anterior surface of the it encloses the lateral surface, and plus it in its upper part you can see this is starting from the anterior part of the head or neck. So surface in between anterior border and posterior border is the lateral surface. If you remember that triangle which I made before, so anterior border, medial border, lateral border, posterior border. So surface which lie in between anterior and posterior border is the lateral surface. The surface which lie anterior and interosseous border is the medial surface. The surface which lie interosseous border and posterior border is the posterior surface. Now this is medial surface, and this is because this border is very close in its upper part. This is not clear in this diagram because this is colored for the muscle attachment, and I just wanted to memorize you the muscles, or summarize you muscles also. So that is why I took this picture. But you have to look for the, it should be starting from the anterior of the neck, plus there will be towards the medial side, very close, like less than 1 millimeter like distance, will be another border. You can see this is another border. Let me take this. Yeah, you can see this is the border, right? One anterior border, this is anterior border, right? This one. I'm taking it fine, and I'm just making it very, trying to make it very accurately, so you should understand. Now this is the interosseous border, which is very close in its upper part, but now you can see it is bit visible here, right? So this is the medial or interosseous border. Right, now this, the line behind this one, this is the medial crest, this one, and this orange is the grooved part of the posterior surface, which give attachment to the tibialis posterior. Right, now this is the medial surface, right, and this is posterior surface. So this is in line with the posterior or styloid process, this border, this one, outer one, in line with this styloid process. This is posterior border, and this border in line with the anterior of the neck, and just medial to the interosseous or medial border, or anterior border, sorry. So this is the interosseous border, this one here, this one in middle picture. So this is the interosseous border, right? And plus the more identical is the medial crest, this one. Upper half of the surface is marked by medial crest, which divide the surface into two parts. So this is the medial crest, this one. Now it's more like accurate, this one, right? So this surface whole is the which surface? Posterior surface. Posterior surface. Now this posterior surface is bifurcated into two parts. The posterior is the which one? The posterior is the flattened part, this one, and the medial is the, or anterior is the grooved part. So this grooved part give attachment to the tibialis posterior muscle, whereas the posterior part in its upper 1/4 it gives origin to the soleus. Rest of the this surface, flattened surface, which lies in between the medial crest and posterior border, this yellow one, this give origin to the flexor hallucis longus muscle. So there are three muscle: tibialis posterior, soleus, and flexor hallucis longus muscle. Whereas in the medial surface, this is the upper 1/4, whole of the upper 1/4 of the medial surface, plus anterior half of the middle 2/4 of the medial surface, gives origin to the extensor digitorum longus, where this posterior half of the middle 2/4, which is highlighted in yellow, give origin to the extensor Hallucis longus, where this lower 1/4, whole of the lower 1/4, give origin to the Peroneus tertius muscle. Now this lateral surface give origin in its upper 1/3, whole of the upper 1/3, plus posterior half of the middle 1/3, give origin to the Peroneus Longus muscle, where the posterior half, anterior half of the middle, 1/3, and whole of the lower half of the whole of the lower 1/3 give origin to the, this yellow one give origin to the peroneus brevis. Lateral surface, peroneus brevis, peroneus longus. Medial surface, extensor digitorum longus, extensor hallucis longus, and peroneus tortius. Posterior surface, tibialis posterior, soleus and flexor, hallucis longus muscle. I hope we are clear.